Hello everyone, and it gives me immense pleasure to be with Dr. Ishmeet, who has got amazing rank of 35 in this INICET paper. Welcome Ishmeet, heartiest
Hello,
congratulations.
ma'am. Hello, ma'am. Thank you so much.
Right. Ishmeet is our Advanced Plus user, and she had seen the app online videos also. She has given the TNTs. She has saw the vibe also. We were discussing all these things with her, and she was telling me how much actually the question simulated with the main paper. Right, Ishmeet. Can
Yes,
you
ma'am.
describe
Absolutely.
that how actually you went through the TNTs or the videos and how they actually helped you?
Ma'am, so during my internship, I did the preparation in three phases. So TNDs I used to watch during my first session of revision. After completing the subject, I used to give the test and then attend the discussion. The advantage it gave me was that in TNDs, all the recent updates were covered. And
Hmm.
along with that, all the important topics, all the previous year topics that are asked in the INI, because that's what they do. They repeat the topics. So it was very helpful for me to have a wholesome understanding of the topic and of the subject itself, that what is important, what is to be focused more upon.
All right. So
Yes,
which
ma'am.
T which TNDs, which subjects TNDs did you like most, Ishmeet?
Ma'am, I especially like Paths the most by Praveen sir, because along with the TND, he covered like all the basic things that are there to be learned, whether it's the stains or whether in like neoplasia also he made it really easy by telling all the important mutations, especially leukemia. It's leukemia is a horrible, it's so much rata. So for that it was very, very helpful. He consolidated it into 3 or 4 pages and it was very helpful for me. Until the end, I used to read that only for leukemias. And otherwise also general path also he covered it really well, all the new terms also, and like it was very high yield. I liked it.
Okay. And did you saw the vibe also, Ishmeet?
Yes, ma'am. Vibe, I did vibe of almost all the subjects. Especially I focused more on radio and vibe because I did not study radio individually, so vibe was a very good source for it, because all the important images were covered, which are like for diagnosis in the exam, and along with that some theory points also.
Mhm.
Apart from that, micro also I like the vibe a lot. All the images were covered, and along with that the little theory that is needed, and basic toxins, everything are covered beautifully.
Okay. How much important vibe is actually in your last phase of preparation when you want to cover everything in the last 10 days?
Ma'am, I think it's very important because vibe is very crisp, and since it's image based, so I think those are the things that you can retain more towards the end of the exam. Like if you just go through it once, there's a high chance you will retain it throughout the exam. So for me, it was very important. I did vibe on the last day itself of a few important subjects, and it just gave me I could go through the subjects quickly, and everything was refreshed in my memory, especially for second year subjects, which are mostly based on like rote learning. So it was very helpful for me. That's why I kept it on the end day for me.
Okay. Acha, Ishmeet, see, whenever we are preparing, you must have seen that
Yes,
we are
ma'am.
preparing and we have notes, maybe from multiple platforms or anything. But it is actually important to maintain a discipline. So that discipline is
Yes, ma'am.
usually maintained with the help of a test and discussion or a TND schedule. So how do you feel
Yes,
that
ma'am.
TND is how much important for your preparation?
Ma'am, I think like for the subjects I did, it was very important for me, not from I'll say timeline purpose of view, because I saw the recorded lectures, but
Mhm.
it was very helpful because for second year subjects are like very huge. So to get the idea of what is really important and what is to be more focused upon, TNDs were very helpful for me, and I got all the recent updates through it in the subjects that I did. So that bit was quite useful. And after I read my subject once, the main notes once, so TNDs were good in having a wholesome revision. Yes, ma'am.
Yes. Okay. So any particular faculty that you would like to thank, which you feel the most high-yield and most helpful in your preparation?
Ma'am, I would like to thank first of all Tamim sir. He's like the god of medicine. His videos were so comprehensive. During my final year, I saw the complete videos, the full course, and like he covers everything so conceptually and makes it very easy to understand. And then during my internship itself, I did not have time to read full notes, so I used sir's LMRP notes, and it was very crisp, covering all the important things. And it made medicine like medicine was in the end a small subject for me because of those LMRP notes and still covering everything. So I would like to thank Tamim sir and Ashwini sir also. His anatomy videos are awesome. I use them like throughout, and especially the cadaveric discussion he has done in his videos,
Mhm.
which did help me a lot in my previous year MCQs, because that is something we're not normally oriented to.
Hmm.
So that was very helpful.
All right. So, Ishmeet, any other message that you would like to give to your juniors or the colleagues that you must have learned from your own journey?
Yes, ma'am. I would like to say one thing that uh, we should never think we can't do it. We just need to have confidence in ourselves and just give the amount of time that is required to crack the exam, and be patient throughout it. There'll be ups and downs. Some GTs will be good, some won't be good. So I think we just need to look at how much progress we have made and focus more on ourselves rather than panicking about the competition that is there. And I would also like to suggest that having a schedule and a proper plan is very important to keep ourselves on the track, so that we are not losing like more time in one subject itself, and covering everything that is important. And especially towards the end, I think it's really important to have a proper plan, and you should be knowing in your head what you're going to do that day.
So, what do you think that what should be done in the last 10 days? What schedule you made actually for yourself?
Ma'am, for my last 10 days, actually, I kept it like I kept it like 15 days plus 3 days. So in 15 days, I did my main notes, whatever I had highlighted. And in last 3 days, I had short notes of those main notes, which I went through thoroughly along with Vibe and the previous year questions, which I used to have problem in. Like I had made a Telegram group for myself, and I went through those questions in my last 3 days, Vibe itself on last day, and the short notes that I have made from my GTs and from my main notes, so that I can go through all the 19 subjects in the end, and not just I am reading one subject on the last day.
Okay, so Ishmi, did you made any 20th notebook kind of a thing to see and review all your mistakes during the last days?
Yes, ma'am. I did have something like that, and especially the things I get confused in through like all these subjects. I had special notes for that. I had special notes for classification, surgery classifications, and scorings are asked a lot. So I had made that separately to go through in the end.
All right. So I think amazing performance, Ishmeet, and
Thank you, ma'am.
I'm sure that your colleagues and your juniors will definitely learn something new, and they can incorporate some good ideas and good inputs in their preparation also.
Mm.
And we are very happy that we were a part of your success story, and we wish
Thank
you all the
you.
very best for your future endeavors also.
Thank you, ma'am. Thank you so much.
Thank you. God bless you.
Thank you, ma'am.